So Anji, today we are going to learn integumentary system. Only nearly 10 questions. So in first, thanks for watching our channel, Anji. So I hope you are learning more from our channel. So please encourage your friends to join in our channel. So just they need to go to you like Google and they need to enter FASTCODER21 medical coding YouTube channel. So directly it will lead to our channel. So today is our prep session. Sorry. Session CPC preparation session 2. So we will start now. So here we have one question, Anji. So physician performed a cryosurgery to destroy 4 premalignant lesions for a patient. Which code should you report for this procedure? So Anji, your answers are A 17106, B 17260, C 17003 into times 3, D 17000 and 17003 into 3. First you try yourself, but if you don't know the answer, I will explain you. Try yourself first. Take 3 minutes, like 2 or 3 minutes. If you finish, please let me know. So if anyone is here, just try to find the answer and write your answer in the chat box. Akash, are you here? So whoever is finished first, just try to enter in the chat box. We will discuss about that answer. Hi Sumlata, thanks for watching FASTCODER21. Hope you have seen the first session. It is very good session. So Anji, we are waiting for your answer, Anji. So Sumlata is already wrote. Anji, are you trying the answer or not? Whatever it is, just write in the chat box so that I will explain why that answer. Can you see now? Okay, don't worry. I will tell you the question. It's okay. Physician performed a cryosurgery. Cryosurgery means physician will use the extreme cold to destroy 4 pre-malignant lesions for a patient. Which code should you report for this procedure? First one is 17106, second one is 17260, and C 17003 times 3, and fourth one are D 1700 and 17003 into 3. Sumlata, can you see properly? Anji, can you see now? I think Sumalata can see you properly. She wrote the answer also. Yeah, please. Sweetie, please write the answer. So we can see the question there. Write the answer now. So physician performed a. Yeah, Vinaya. Hi, Vinaya. Good evening to FASTCODER 21. Yep. So the people who wrote D are correct. So as all of us know, we have 3 types of cancers like benign, pre-malignant, malignant. Good evening, Vinaya. Thanks for watching FASTCODER 21. So malignant lesions will expand rapidly and they spread to other organs. So benign lesions, they will not expand rapidly, but they will stick at one place. So pre-malignant, it is like in between benign and malignant. So as all of us wrote, all of you wrote, answer D, it's correct. So sweetie, we can discuss general questions later. So first we will complete this session. So afterwards we will discuss. So anyway, I think all are wrote answer D, which is correct. So as if we see here, so here, if you see here, destruction, benign or pre-malignant lesions 17002 17250. If we see here, destruction, malignant lesions, any method. So we have destruction, benign or pre-malignant, one series, and destruction, malignant lesions, any method, one series. So here our question, it includes pre-malignant. So we need to click on pre-malignant now. So as per our question, we have physician destroyed 4 pre-malignant lesions. So we need to check. How do we check? We can see now. So distraction. So distraction means it includes any type of surgery. For example, laser surgery, electrosurgery, cryosurgery, chemosurgery, surgical curatement, pre-malignant lesions. Example, actinic keratosis. So usually actinic keratosis are the pre-malignant lesions. So these are examples. You may find more lesions or more lesions. So as based on question, we have 4 lesions. So we need to calculate here. So for first lesion, we need to code 17000. So second lesion, here it is mentioned each. Total we have 4 lesions. So first lesion we will code 17000. For because of this each word, we need to code 17003 add-on code 3 times because of this each. If we don't have each word here, we can code directly 17003. So next one. So what happens? So for example, if you have 10 lesions means 1700 into 17003 into 9. What do you do if you, after watching this, how do you code if you have 20 lesions? Can anyone tell in the chat box? So right, how do you code cryosurgery of 20 pre-malignant lesions? Yeah, correct Vinaya. So only destruction, pre-malignant lesions, actinic keratosis, 15 or more lesions, we have only single code. We no need to use. No sweetie, that is wrong. So why means if you see the like description here, 17000 is for first lesion. Yeah, no problem, sweetie. Anyway, it is good. Next time you can remember easily. So see here, plus means we can't use it as a primary code. So it is a add-on code. So never we can code add-on code as a primary code. So 17003 second through 14 lesions means this is first lesion, second to 14 lesions each. Each means we need to code each and every lesion. But that is below 14. Below 14 only we need to code this one. So if it is above 14, we need to use 17004. So last and final, we can practice one more and we can conclude this question. Only question, not session. So how do you code 26 lesions? So destruction of 26 actinic keratosis using cryosurgery. So write in the chat box now. Sweetie, now you need to write correctly. Now you understand. How do you code destruction of 20 pre-malignant lesions? Yeah, then write the answer, sweetie. So it is, if you know, if you understand properly, you can write the answer. No, otherwise, I can explain one more time. So now we have 20 lesions. You think like that, more than 20, like 25 lesions. Sometimes you see in documentation like actinic keratosis instead of pre-malignant lesion. So that is why always you need to check CPT book in order to code properly. Yeah, yeah. Correct, Anji, you are correct. 17004. As this code description includes 15 or more lesions. Yeah, sweetie, I think you understand now. Anyway, good that. If you don't understand, just send mention a chat box. We can discuss again. So first lesion, only one lesion, we will code 17000. For example, if the patient has 10 lesions, how do we code? 17000 into and 17003 into 9. So first one is for first lesion, 17003 into 9 for remaining 9 lesions. So if we have 20 lesions, directly we need to code this code. No need for add-on codes or this primary code. So in while writing, if you see the CPT book, always check before and after the codes. So next question we have. So here this is the case scenario here. So preoperative diagnosis, right hand lesion. So pathology is telling that it is a primary malignant carcinoma right hand. So it is malignant tumor or malignant carcinoma. So procedure performed, excision of malignant carcinoma right hand. Anesthesia is general. So here procedure is the patient was brought to the operative suite where the right hand was prepped and dressed. This is the common procedure needs to do before surgery. So a circular incision was made to include the 1 centimeter lesion with narrowest margins of 0.6 cm with dissection down to subcutaneous tissues. So remaining this is not necessary. So our important point here is, this is the important point we need to understand. So these are common. Hemostasis was obtained. The wound was closed with simple matrix sutures. The patient tolerated the procedure well and was returned to the recovery room in good condition with sterile dressing in place. So take few minutes. All of you write the answer in the chat box. So all of you write answer in the chat box so that we can discuss. What are our options? 11603, 11622, 11423, 11403. If you have CPT book, just open your CPT book. See 11603, 11622, 11423, and 11403. So we will check combinedly. So we have 11403 here. So we need to first check here location of the carcinoma or malignant carcinoma. So here our location is hand. This is very important to understand. So Y means our excisions are depends on location and the dimensions. So here our location is the hand and lesion size is 1 centimeter with narrowest margins of 0.6 centimeter. So can anyone tell me how much size we need to consider now? What is the size we need to consider? Just write in the chat box. So if you don't know, I will tell you. So how do you check the code now? What is the criteria to check this code? So how do you code? So Vinaya wrote the answer. So remaining people, Anji and Sweetie, right? Anyway, you can think anyone. So I will tell the answer here. So here 11403. So what is 11403? So if you check 11403, Vinaya, first we will discuss the lesion size. Afterwards, we can do the code selection. So based on CPT guidelines, we need to add lesion size with margins. So already in the document, it contains 0.6 centimeter margins. So margins means plural. Na? So we need to add 1 plus 0.6 centimeter. So it will become 1.6 centimeters, not 2.2. So I got it. You have double this one. 0.6 plus 0.6, 1.2, and this 1 centimeter, 2 point, total 1.2.2. So that is not correct. So here already mentioned margins. So now total lesion size is 1.6 centimeters, and among these four you can check. So our location is hand and lesion size is 1 plus 0.6, 1.6 centimeters. So you can check all these codes and check the answer. Tell me the answer or write in the chat box. No worries, Vinaya. No worries. Yeah, it is CPT is like that only. We need to read it properly so that we can write easily. So now you can guess the answer and write it in the chat box. So how much it is now? 1.6 centimeters. Total lesion size is including margins 1.6 centimeters. So now you can check and tell me the answer. Write in the chat box. Yeah, that's okay. 1.6 okay. What is the answer among all these four? 11603, 11622, 11423, 11403. Yeah, all of you correct. So now the answer is 11622. We can check here. See here. See here. This is the lesion size 0.2 centimeters. Margin here. If you see here singular margin and this one margin. So here they have added two margins. See here, because of these two margin, they have mentioned here margins, plural. So because of that, they have added 0.2, 0.2. So total 0.4. If it is margin, we can add. But here in our question, they have added margin. So already physician gave the margin. So we need to make it double. So 1622. So we need to check the, yeah, here excision, malignant lesion including margins, trunk, arms or legs. So our question comes under arm. So answer is 11622. It is 1.6 centimeters. So it will come under 11622. So we can go to next question. I hope everyone got understand this one. So if anyone any doubt, just mention in the comment section. So next one, patient underwent a fine needle aspiration with ultrasound imaging guidance for a lesion in the right breast. During the aspiration procedure, a percutaneous metallic clip was placed in the right breast under magnetic resonance guidance. Which codes describe this procedure? I hope Anji, can you see properly now? Previously you told you can't see properly. I hope you can see now. So here FNA fine needle aspiration with imaging guidance for a lesion in the right breast. During the aspiration procedure, physician has placed one metallic clip also using the magnetic resonance guidance. So which codes you will utilize? So please write your answer in the chat box. You don't need to take much time. Just go to the CPT book. First to check 10005, then check 10021 and 19295. So write your answer in the chat box so we can discuss remaining. So we will wait for one more minute, then we can discuss. So you can write any answer. No need to make tension. It's not a exam anyway. Yeah. All you need to write any answer, no problem with the answer. Anji, what about Anji, sweetie? Hi DS. Thanks for watching FASTCODER 21. Sweetie Anji, try yourself. It's free only, just try so that you can get the confidence. DS, I hope you have the CPT book with you. Just try this answer. If you don't know, we will learn. So patient underwent a fine needle aspiration with ultrasound imaging guidance. Yeah, go ahead DS. For a lesion in the right breast. So here we have two procedures. One is FNA using ultrasound imaging guidance. Second procedure is placement of percutaneous metallic clip. So that's why we need to select two codes. Whenever like this question, first of all we need to check the laterality. So in this question, laterality is right. So there is no problem with laterality. So next, you need to go to the index also. Directly you need to go to the like code, and you need to compare that code description with this question. That's enough. So we can analyze the answer now. First one is 10005. So here if you see, so our question is fine needle aspiration, lesion on the breast, including ultrasound guidance. So 10005 is for ultrasound guidance. So what is next? 19287. We will check 19287. So placement of breast localization device. So which includes clip, metallic pellet, wire or needle, radioactive seeds, percutaneous first lesion, including magnetic resonance guidance. So our answer is 10005 and 19287. We will check what is 10021. So it is also fine needle aspiration biopsy, but different modality, which is fine needle aspiration biopsy without imaging guidance. See here. So this is the very important point we need to understand. So whenever we code fine needle aspirations, we have with imaging guidance, without imaging guidance. This is the code criteria. Based on this imaging guidance, we need to select the answer. So anyway, here without imaging guidance, but in our question we have ultrasound guidance, so it is not correct. 10021 is not correct. So we can remove this one, and here we can check 100 10005 RT, and our one more code here is 19297. So here this is different description or different code. This is like implant or catheter placement concurrent with partial mastectomy. As in our question there is no mastectomy, so this code is wrong. This is also wrong. These both are not related to our question. So here our answer is 10005 RT 19287 RT. Yeah, Anji, you are correct. You are doing good. But only important criteria here is you need to check the imaging modality. Why means if you check here, we have ultrasound modality and mammography and fluoroscopy also. So we need to check the modality very importantly. So next question, which of the following procedures could be coded with breast reconstruction with free flap? So we need to identify here what are the conditions we can code along with free flap. Anji, can you try this one? So anyone can tell the answer. So which of the following procedures could be coded with a breast reconstruction with free flap? Harvesting of the flap, microvascular transfer, closure of the donor site and insert shaping the flap into a breast, none of the above. So basically here we need to code what we will code along with breast reconstruction with free flap. So here the answer is none of the above. Why means harvesting of the flap included in the code, microvascular transfer is also included, closure of the donor site and insert shaping of the flap into breast is also included in the breast reconstruction with free flap. So we can't code any code along with this question or that code. So if we check reconstruction, you can get easily. We check reconstruction. You go to reconstruction breast, you can get the answer. Reconstruction breast to free flap. This is yes here. So you go index, reconstruction and breast with free flap. You need to check that. See, we are nearby here. So if you see here, reconstruction, based on our question, we have breast. Breast with pre-flap. Reconstruction, breast with pre-flap. So here our code is 19364. So in order to code that question, we need to go to 19364. So we will go to 19364. So see here, code 19364 describes a microsurgical pre-tissue transfer of skin and subcutaneous fat and our muscle for best reconstruction. This code includes the flap harvest, means harvesting is included, harvesting of the flap is included, and microsurgical anastomosis of one artery and two veins with use of an operating microscope, flap inset as a breast mount, and donor site closure. So all these procedures are included in 19364. So because of that reason, we can't code any of these codes along with 19364. Why means all are included in this code 19364. So microvascular means here they have mentioned, you see, they will anastomose arteries and veins. Which one we will call it as microanastomosis, or what is that, microvascular. So I hope you got this answer. So we can check next one. Yeah, yes, Vinaya 19364, but here we need to check. Oh, so what are the components included in 19364? If you see here, so all these components, harvesting is included, microvascular transfer is included, closure of the donor site is also included. So basically in CPT, any type of procedure, closure of the donor site is included. It is based on the global period. So maximum it is included. So here because of that reason, we can't code A, B, C along with 19364. C. Because of that reason, our answer is D, none of the above. I hope everyone got this one and you understand this. So next, we can check fifth question. So patient underwent a complex incision and drainage. Hi Kalyani, welcome to FASTCODER 21. So now onwards, you can try to answer the questions. So remaining, you can check after mentioning in the our live session after. So now you can check Kalyani this one. Patient underwent a complex incision and drainage due to a post-operative wound infection, which required an extensive secondary closure of the surgical site. Which course describe this procedure? So all of you open your CPT books and check these codes first. Just check the course and compare with the question. That's enough. No need to take risk. Just open your CPT books, check 13160 and compare the code description with our question. Even CPC exam also like that only. So you need to have good idea how to compare our code description with our question. So if you compare properly, answer is very easy during the CPC exam. But in live session, it is not like that. Like live coding, just try yourself. We will give you 2 minutes. So you can write any type of answer. No need to worry. So anyway, we are learning here. So you can type any answer. See the codes properly, top and bottom of the code in CPT book. So you can get the answer easily. Check first 13160 and check before and after that code. Check 181 and check 10121, 12020. So all of you check this code in the CPT book and check before and after that CPT code. So you can get the answer easily. So we will wait for 1 more minute and then we can discuss the answer. So here it is a post-operative wound infection, IND, post-operative wound infection, which required an extensive secondary closure of the surgical site. So write any answer, no need to worry, A, B, C, D, anyone. Just guess. In CPC also you need to write anything. So just you don't keep it blank. Yes, you need to guess the answer right. Yeah, go ahead. We need more answer. Vinaya, we can wait for 1 more minute and we can discuss this answer. So we will discuss, Vinaya. So I think people are on other task. So we will check 13160 first. So we have post-operative wound and that wound we have closure, secondary closure. So first we need to check. But as we are using the software, it will like PDF, it is taking time. But if we have physical copy, it is very easy. So directly you need to go to the code and you need to select. So 13160, secondary closure of surgical wound or dehiscence, extensive or complicated. So what is our question? So here extensive secondary closure of the surgical site. So if you compare this question with this answer, this code description, which is matches. So as I told you before, you need to check before and after this 13160. So if we see here, do not report 13160 in conjunction with 11960. That is something different. So for packing or simple secondary wound closure, we need to check 12020, 12021. So anyway, this is secondary closure, which is correct along with our question. Now we can check 181. See here, which is pilonidal cyst. That is wrong. As per our question, we don't have any pilonidal cyst. Only it is a post-operative wound infection. So first one is wrong. So next one we will check 10121. So what is 10121? So here it is telling incision and removal of foreign body subcutaneous tissue, simple. It is complicated. So our question is related to incision and drainage. Here there is no mention of drainage. It is 10121 is for incision and removal of foreign body, which is complicated. So this is also wrong. So we will check 106.1. So 106.1 is top only. So this is for incision drainage of abscess, carbuncle, separate to hydradenitis, cutaneous or subcutaneous, simple or single, complicated or multiple. So here we need to check this code description with our question. Ours is not an abscess. Ours is post-operative wound infection. So third one is also wrong. So now we can, sorry, D is also wrong. Now we need to check 13160. Previously we have seen 13160 is for closure. So we will check 10180. Yeah, if you see here, incision and drainage complex postoperative wound infection, which is completely related to our question. So even we too have the postoperative wound infection, incision and drainage. Here also postoperative wound infection, incision and drainage. So I told you before that you need to check before and after this any code. If you do CPC or if you do live coding, so that you can get the answer easily. So based on this question, we have post-operative IND of post-operative wound infection as well as extensive secondary closure. So if we check here, directly they have mentioned incision and drainage complex post-operative wound infection. If you read this question, you can write easily the answer. See here, we have 13160 is mentioned for secondary closure. So here our answer is 13160, 10180, 51. 51 is for multiple procedures in same session. So I hope you guys got this answer. So, so we will go ahead with, we have four more questions. We will finish fastly. So next one, Patricia discovered a lesion on her trunk. Yeah, no worries, Vinaya. No, you got it, na? So 100, 80 and 10180. So CPC is like that only, na? Even AAPC know that it is only comparison of our question with the code description. But the thing is that because of that time restrictions, we feel nervous. So because of that, we can't see or we can't see the course properly. Anyway, don't worry. If you do more practice, you can code properly. So now you got, na? Our answer is, yeah, good, Vinaya. So here this is related to Mohs surgery. So Patricia discovered a lesion on her trunk and was referred to Dr. Smith for treatment. Patricia had no prior pathology of this session. Therefore, Dr. Smith completed a diagnostic skin biopsy with frozen section prior to the surgery. So after reviewing the biopsy result, Dr. Smith took the patient to the procedure suite and performed a Mohs surgery on the same day. Dr. Smith's final report indicated the procedure required 3 stages, including 5 blocks in each stage. He had to take an additional 4 blocks in 2 stages to verify margins and cell structure. Which code should Dr. Smith report for this entire encounter? So guys, just try this one, which is bit complex only, but you will take 1 or 2 minutes for this. Just guess any answer. No need to worry about the answer. Just any answer you can guess. We will learn afterwards. So here also, if you see here 17311, so here also depends on the site. So we need to check the site properly. See here, it is related to trunk, arms or legs. If you see here, 17311 related to head, neck, hands, feet, genitalia or any location with surgically direct involving muscle. So you need to check what is our site here first. Our site is trunk. So we need to check where does this trunk comes. See here, if you see 17313, first we need to locate that location. So we have selected 17313 for as our question contains trunk. So 17311 is wrong. Why means there is no trunk in 17311 code description. 17313 is having the code description trunk. So here our first answer is 17313. So here we need to filter. So as we know, 17311 is wrong. So why means trunk is not included in 17311. So here we need to skip these two questions. Sorry, these two CED we need to exclude CED in order to find the answer. So we have only two options, A and B. So we need to check the answer now. So what he did first, 5 blocks in 3 stages, including 5 tissue blocks in each stage. So we will check 17313 description here. See here, first stage up to 5 tissue blocks. So total how many stages we have? 3 stages here. 3 stages including 5 tissue blocks in each stage. So if we check here, so 17313 is for first stage. We have total 2 stages. Total 3 stages. So 17313 is for first stage 5 blocks and add on code 17314 for remaining 2 stages. Here see, here the word each additional stage means second stage we need to code 17314 and third stage we need to code 17314. So our answer is here 17313 is for first stage, 17314 times 2 for remaining 2 stages. So this is for first stage and plus 17314 each, because of that each we need to code 17314 2 times because we have 3 stages. 13 for first stage, 17314 for second stage, 17314 for third stage. So half of the answer we got now. So next we got one 4 blocks in stage 2 to verify the margin. So we need to check 17315. So based on code description, 17315 is for each additional stage after first stage. So this is any stage and we have 4 blocks. So here we need to code 17315 into 4. So as patient does not have previous lab results, we need to code 11100 and 88333159. While learning pathology, we will learn about 88331. So I think you got this answer. So if you don't know, if you don't understand this, please mention in the comment. I will explain one more time. Vinaya, did you get it? So our next question is, patient cut his hand and arm while working on his car. Doctor applied sutures to both the arm and hand wounds. An intermediate closure of 16 centimeter was placed in the arm and simple closure of 3.6. So Vinaya, now DS is telling that DS did not understand this. I will explain one more time. We will complete later. So DS, we need to check here. First, we have 3 stages, including 5 tissue blocks in each stage. Okay, na? Yeah, okay, Vinaya. After explaining you, we will check 11100. So three stages including 5 tissue blocks in each stage. DS, first of all, whenever we code more surgery, we need to check the location of the surgery. So here our location is trunk. So we need to check the trunk description now. Like 173, we have two codes here, 17311, 17313. So if we check 17311, trunk is not included. See here it is related to head, neck, hands, feet, genitalia or any other location. So 17311 is wrong. So we can't consider this code to answer. So we can exclude these two C, D for selecting the answer. So we have only two options now. So 17 A, B, we have the options. So we need to check the code description 17313 first. If you see 17313, here trunk is included. So we need to confirm that we need to code initially 17313. So here we have three stages including 5 tissue blocks in each stage. So how do you understand this? 17313 for first stage up to 5 tissue blocks. So how many stages we have total? Total we have three stages. Okay, na? So three stages means 17313 for first stage up to 5 tissue blocks and add-on code 17314 for remaining two stages. So as we have three stages, 17313 for first stage, 17314 and 17314 for remaining two stages. So here if you see here it is code description contains each additional stage. So here we need to code two times 17314 two times. And we have one another stage also here. For additional stage we need to use 17315. See here any stage after three stages we need to code any stage here 17315 into based on our question 4 blocks. So we need to select here 4. So under 4, 4 is below 5. So we need to select 17315. I hope you understand now. So Vinaya will check that what is that 11100. So sorry 11100. Vinaya, that code is deleted. Just we are learning only regarding Mohs surgery now. So 11100 is deleted already. So just to concentrate about Mohs surgery now. Yeah, that's why I told you that is old answer. So skip that 11100 for the time being. Just concentrate on only Mohs surgery. So we will go ahead with seventh question. Patient cut his hand and arm while working on his car. Doctor applied sutures to both arm and hand wounds. An intermediate closure of 16 centimeter was placed in the arm and a simple closure of 3.6 centimeter was placed in the hand. Which code should doctor report? So you guys take 2 minutes and answer it. So I will tell the answer now. So first we need to check 12004. So what is this? Simple repair. So but what is the location here? Our locations are arm and hand. In 12004, hand or arm are, yeah, based on centimeters, we need to check this code. Yeah, extremity is correct. But you need to check the centimeters also. As you know, based on centimeters, we need to code. See here, extremities, hands included here. So first, what is the dimension of simple repair? 3.6 centimeter. So what is here? 3.6. So simple repair 12002 2.6 to 7.5 centimeters. Ours is only 3.6 centimeters. So we can code 12002 for simple repair. So now we need to check for intermediate repair. 12035 we can check. So if we check 12035, repair intermediate wounds of scalp, axilla, trunk and or extremities excluding hands and feet. So here we are looking for arm now. So if you check the dimension here, 16 centimeters. This is the intermediate repair, 16 centimeters. So this is the intermediate repair and arm is included in this code description. So we need to check 16 centimeters which code comes. So if we see here 12035, 12.6 centimeters to 20 centimeters. So in our question we need to code only 16 centimeters. So here our answer is C 12035 and 12002 59 as based on CPT guidelines. Whenever we have multiple repairs, we need to code more complex repair first, then simple. For example, if we have complex, intermediate, simple, how do we code? First we will code complex, then intermediate repair, then simple repair. So because of that CPT guideline, we have coded intermediate repair first, then simple repair later. Vinaya, this is C. Yeah, here we need to use the 59 modifier, different location. So 51 is for multiple procedure and same location. 59 is for different locations. Yeah, 51 is for same location, multiple procedures. 59 is for different locations. Yeah, different locations 59, same location 51. So previously we have added one code. Na? For example, wound excision with simple repair. For example, complex repair we need to code same wound. For that wound only we have complex repair. So that time we need to use 51 modifier. So why means there is no distinction between the sites in wound repair with closure. Vinay, I think you got this one. You got this answer now, 12035, 1200259. 51 is for same location, multiple procedures. 59 is for different location, as we have arm and hand. So 59. Yeah, next we can see we have only two questions now. So a patient underwent an excision of 2.1 centimeter diameter malignant lesion on her nose, and 11.2 square centimeter adjacent tissue transfer is required to repair the primary and secondary defect sites. How should you code this procedure? So you guys take 2 minutes and answer this one. So if you guess within 1 minute, you may know something. Otherwise, I will explain. So I think you guys are trying for that. Yeah, DS, answer A is wrong. So only we will conclude this question very fast. So based on CPT guidelines, along with benign and malignant lesions, if physician performs adjacent tissue transfer, we need to code only adjacent tissue transfer. So here no need to code malignant lesion on her nose. So here our answer is 14061. So we no need to code malignant lesion excision code here. So if you know the guidelines in CPC exam, you can write easily. Like if you know that guideline, you can select B within a short period. So based on CPT, we need to code only adjacent tissue transfer along with benign or malignant lesions. So here our answer is 14061. So next, patient required a replacement of his non-biodegradable using a drug delivery implant system. Patient was taken into the procedure suite where he was prepped. Doctor injected a local anesthetic and made a 3.2 centimeter incision in the skin for removal of the previous cylinder. He then replaced the cylinder and sutured the new device in place with single running stitch. The 3.2 centimeter trunk wound was closed with simple closure or simple suture. The device was tested with excellent results. The patient tolerated the procedure well and was released from the care with a sterile dressing in place. How should this procedure be coded? So just check these codes in the CPT book. Check what is 11983, what is 11982, what is 11981, so that you can get the answer easily. You guys check. We will see the answer later. So here what happens? Physician removed one and replaced it with other one. So If you check 11981, you guys check among yourself and write answer in the chat box. So if you see the code description, we can answer this easily. So as per our question here, physician has removed and replaced. See here, replaced means he removed the old one and he replaced it with new one. So here it is a replacement. So if you see the code description, 11981 for insertion, 982 for removal, 983 for removal with reinsertion, non-biodegradable drug delivery implant. So here, what is our answer? D. See 11983 and 12002 51. 12008 is for repair. So here our answer is 11983 and 12002 51. See Vinaya here. Here modifier 51 is for here procedure performed on same location. That's why here we have used 51 modifier. Same location 51 modifier, different location 59 modifier. Yeah, that's why 51 modifier. Great Vinaya. I think you got you learned something today. And all of you please like our session so that I will get motivation to prepare more sessions like this. Please click on like button. And also if you have, I will spend 5 more minutes for you. So if you have any doubts, please mention in the chat box. So today we have completed this question and answer. So if you have general questions, please mention in the chat box. Now it is 9:11. I will wait until 9:15. No Vinaya, this is 2022. If you have 23, give me. So previously someone asked to some doubt. So waiting for 2023. If you have any reference for 2023, 2023, give it to me, Vinaya. So if anyone has any doubt, we will clarify here. Otherwise, we will end this session here. Yeah, thank you, Vinaya. Please give me also. So 26 is for professional component, TC is for technical component. So usually physicians will build 26. Why means they will read the reports. So they will use 26 and TC is for technical component. That means that machinery is not related to the physician. So some other facilities, physician will use the machinery. That time that facility will use the technical component TC. So we have 2 more minutes. Vinaya Anji. DS, do you have any doubt? One more minute. Good DS. So you no need to worry. After this stream ends, again watch it once. So you will get good idea. So if you have any doubts, just place it in the comment section. I will explain once again. What? When both will give? I did not get you, Anjay. Okay, guys. Now we will conclude this session. Next week we will meet you again. Thank you, guys. Please like and encourage our friends to join in our channel. Thank you. Bye. Take care.